the Fellowship of the Great Physician. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practiced independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimal health and wellbeing.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great that you've invited us into your home and make a house call or wherever you are at work or nursing home, wherever it might be. We're just pleased that you've welcomed us in, and we are in a series that we've been doing. This is part 6 on you and your hormones, and it is designed for both women and men. And in this dimension now we're going to start talking about the complex biochemical links between our hormone-producing glands. And so everything in the body was created to be in ratio. In other words, even though this finger is functioning by itself, there are other ligaments and tendons and muscles and arteries and nerves and veins that are working. So everything is linked. And often what we do is we say we have a skin problem, we see the dermatologist, and he says, well, here's some cortisone cream or whatever, when in fact the skin problem might be to some biochemical irregularity. So they're basically treating the symptoms. Sometimes we go to a nutritionist and they say, well, we have dysmenorrhea or low testosterone or something like that in the case of a male. And they say, well, here, take this. Well, instead of doing biochemical testing to see what those levels are, often they're just treating the symptoms, which is like putting frosting on top of burnt cake. So Dr. Jensen is going to start talking about our ovaries and our testes and our adrenal glands. Dr. Jensen?
Thank you, Dr. Lala. Well, it's a very complex biochemical process that goes on in your body every day, and the hormones are nothing less than that. They're also very complex and have biochemical links all over the place. And here we're looking at the ovaries and the testes and the adrenal glands are all interrelated and dependent upon such other chemicals as cholesterol, progesterone, DHEA, and aldosterone. And if you look at it, let's say you're in a restaurant and you're ordering something, and the raw materials that they need for the type of thing that you're ordered, they need to have that. So if you're ordering a hamburger and they're all out of buns, they come out and they say, hey, we're all out of buns. We could give you the patty or something like that. Well, in this case, if you need certain hormones be made and you're low in cholesterol or it's being used in some other thing or progesterone, stuff like that, it's just not going to happen. And sometimes we find that in clinical practice with, say you have these young females who are Olympic athletes. They have such a low amount of fat in their body that they're not creating their hormones, and therefore menses stops, okay? Or many other conditions that can be interrelated to that. So that we find the ovaries and the testes and the adrenal glands are related to and dependent upon proper levels of cholesterol, progesterone, DHEA, androstenedione. And interesting, only about 2 to 10% of progesterone circulates unbound in the plasma. Otherwise, it's bound up and is not ready for being processed. Cholesterol and progesterone are both fat soluble and are similar in molecular structure. Therefore, it is the binding that makes it water soluble and allows it to be transported. Okay. Within our cytoplasm, the liquid surrounding the nucleus of our cells are minute cells called organelles, which contain mitochondria, and under normal health have an innate ability to convert cholesterol or into pregnenolone, which then is converted to progesterone or DHEA. So it's these other little organelles that need to do the conversion. Well, in order for those raw materials to get to it, it needs to get into the cytoplasm, which is the liquid inside of the cell. In order to get to that, it has to get through the cell membrane. And in order to get through the cell membrane, either it has to be through, either it's fat soluble and passes straight through it, or it needs to be bound to a protein or some other substance that then it's mechanically brought through in a channel to bring it through. So the cell, the reason why there's a membrane around the cell is to dictate what comes in and what gets left out of the cells. So mitochondria then, being namely used for creation of energy and increasing our metabolism in our body, also helps create these other hormones, such as progesterone from cholesterol, which is the basis for all the other hormones to be made from it. It makes the raw materials or the materials that need to be there for the rest of the hormones to be created. Now, the effects of androsterone. It's stimulated by ACTH, or adrenocorticotropic hormone, which means that it works on the adrenal cortex, and tropic means it works right there at that tissue. It affects the kidneys and affects blood pressure, because aldosterone is the one that affects how much water we retain. If we keep more water, what happens is it increases our blood volume, because blood is made a great deal out of water. If you have more blood volume, your blood pressure increases, okay? So aldosterone promotes the transport of sodium and potassium in the kidney tubular walls, as well as the transport of hydrogen ions when potassium is high, because sodium retention, which then affects the amounts of fluid in the kidneys and how much they retain or excrete. The more fluids our body retains, the higher our predisposition to hypertension, high blood pressure. This is why some doctors prescribe medications which will cause the kidneys to excrete more fluids. So, some more of the effects of aldosterone. Decreased things in the body. Decreased aldosterone creates hypercalcemia, can heart toxicity, arrhythmia, and heart failure can also occur. Excessive may result in hypocalcemia or low calcium, muscle weakness, muscle joint pain, fibromyalgia, myositis, and arthritis. Now, of course, hypercalcemia is excess calcium in the blood, usually due to lack or loss of potassium. In sodium-potassium ratio, that balance may be off, and that's what the whole thing about kidneys are. It's a balance between these electrolytes in the body, which then affect our nerves and our muscle tissue. This results in heart muscle toxicity, can result in arrhythmia or cardiac irregularity, and eventual heart failure. Hypocalcemia, or below normal plasma levels of calcium, predisposes people to muscle weakness, osteoporosis, fibromyalgia, arthritis, myositis or inflammation of the muscles, and neuropathy or all other kinds of muscle joint problems can result from that. Now, aldosterone, sweat and salivary glands, and intestinal absorption can affect these things. And if that does so, if aldosterone is off, it can result in things such as diarrhea, low testosterone, estradiol, estrogen, and estriol imbalances, renal tubular reabsorption problems, and sodium-potassium ratios being thrown off. So the kidneys are in part designed to reabsorb sodium to conserve sodium chloride in our sweat and in the salivary glands. One of the things is that when you sweat, the water just doesn't come out to the surface of your skin. What happens is you have these sodium pumps that push the salt out to the outside of the skin, and the water follows. That's why your sweat tastes so salty. We find this also in the salivary glands as well as the intestines, but potassium and bicarbonate are secreted by the ducts of those glands. Unabsorbed sodium chloride and water lead to diarrhea with a loss of further sodium chloride and water. It should be noted that androstenedione also has a cross-reactive role with the synthesis of testosterone and estradiol, and that estradiol has a cross-reactive role with estrone, which in turn affects estriol. So it affects your entire estrogen family of hormones. This sounds very complicated, but from an overall view, it is good to keep in mind that we have those activities going on in our bodies, and that sodium, chloride, and potassium not only affect our sweat glands and salivary glands and intestines, but our female and male hormones as well. So later on, we'll give more attention to testosterone and the estrogen family of hormones. Dr. Lala?
And that's exactly what I'm going to do, is give more attention to testosterone and the androgenic male hormone. Its primary effects are sexual characteristics, muscle mass and strength. You can see I have a lot of that. Bone density, sense of well-being, cognitive functions, and emotional balance. Testosterone, interestingly, is secreted by, of course, the testes. The small amounts are secreted by the ovaries as well as the adrenal glands. It is, when functioning normally according to God's design, converted to an androgen called DHT, or dihydroxyestrone. Dihydroxytestosterone deficiency and or excess leads to serious health problems, and let's discuss that now. So it's converted to androgen, DHT, in certain tissues. Deficiencies or excess levels in men or women can lead to serious health problems. It's found in females also. Both men and women have testosterone, just as men have estrogens. Deficiencies of it can lead to osteoporosis. If deficiency is involved in men or women, it can predispose them also to muscle and joint and bone problems, as I said, including osteoporosis. And of course, testosterone is needed by women for bone deposition of their calcium. In women, it is usually at lower levels. Both in women, it plays roles in health of her bones, her strength, her vitality, the ability to handle stress. Now, Dr. Jensen is going to look at estradiol.
Thank you, Dr. Lala. What we have is estriol, which is one of the estrogen family of chemicals. We actually have estriol, estradiol, and estrone. And what we look at is that on the estrogen receptors, there's alpha and beta receptors that are created. And some are more reactive than others in the body. We have, of the family of estrogens, we have estriol and estrone react with just the alpha or just the beta of these, and they react in different tissues, which we covered in a different show. But the estradiol reacts with both alpha and beta, and it's actually 3 times more powerful in its effects than these other two. So to keep estradiol in check, our estriol and estrone, if those levels are kept up, they'll keep the estradiol in check with those people who have excessive estrogen-related cancers. So estriol is less potent than estradiol, and when in the presence of normal levels of estrone, keeps estradiol in check. So individually, estriol and estrone have 1/3 the potency of estradiol, but put together, again, they keep estradiol in check. So then let's look at a little bit closer at estradiol, which is the most potent of the estrogen hormones. It's synthesized from estrone and testosterone. So we can see where it has 2 levels of things that go into its creation. It's synthesized in the ovaries and in the testes. So men, yes, you do have estrogens in your body. Stimulated in perimenopause by luteinizing hormone and follicular stimulating hormone as well. So whenever there's excessively high levels of estradiol, you may see health problems, including cancers, just because of the overstimulation of those hormone-sensitive tissues. Estradiol in excessive levels can lead to breast and ovarian and uterine problems, because those are the estrogen-sensitive tissues that it reacts upon. Postmenopausal levels of estradiol should be lower than estrone and estriol. So whenever there are excessively high levels of estradiol, remember, again, you put yourself at potential risk for those estrogen-related cancers. Now, natural estrogen, when based on science-based test results, okay, so that we know what needs to go in there. It's not, if you're not informed, you can't make the correct decisions.
And then there, of course, are some tests that may have some validity, and there are some tests used that have no scientific validity, but people are using them, and you say, well, this doctor's using them, so they must be scientific.
Right.
You know, and so I think we have a video that they're going to bring up that talks about, it doesn't really talk about kinesiology, does it? But it's give an example of kinesiology.
It uses it as an example.
And certainly you and I use kinesiology muscle testing in our practice, but it is not the thing that tells us what to treat specifically or totally.
It might give us an idea of
Gives
where
us an
to
idea.
go.
And in the case of hormones like this, now that we're starting to talk about natural hormones, we use hormone analysis to substantiate what the body is signaling to us. So
Right.
whenever they get ready to
Which
run that,
gives us concrete, objective numbers rather
Right.
than subjective
That's right.
feedback.
That's
and so
right.
let's bring up that video now.
not in any way putting down kinesiology.
Coming down this.
Put your hand here.
Brakes. Rotors. Calipers.
It's the calipers. It's okay.
Roy! Calipers!
Don't you want to take out some tools or something?
That's not how we do things here. Don't worry about it.
Roy!
That's not now.
That's
So-
very interesting. Go ahead.
Yeah, so if you look at if you brought in your car and somebody did that kind of testing to tell whether that was the problem that was wrong, and what they're basically playing off of is surrogate testing in that case, where they're testing the vehicle through the person, how much confidence would you have that that's actually what it needs?
That's right. And I think that one of the issues that I have with it, and as I said, I'm not in any way opposed to kinesiology. One of my closest friends in chiropractic was one of the founders of kinesiology and developers of it in America.
Absolutely.
We're sitting at his footsteps, and so we use it. But
And instrumental in me taking it up as a career.
right, and but when it's used just to sell vitamins without any other blood test or hormone test, then it's wrong. And we get mailings frequently from these vitamin companies and vitamin distributors that are saying, come to our seminars and learn kinesiology, and then you go to the seminar and you hear them talk about how much money the doctor can make selling vitamins. Or they'll have some people working for them, some doctors working for them that are going to be these other doctors' coaches. And then they even say this doctor will get a percentage of all the increased sales that you have of vitamins. And I say, well, you know, that's America, that's secular humanism, but for me, when you shine the light of Christ on it, I don't think Christ would involve himself in something like that. I don't think so whatsoever. So what about natural estrogen?
Okay, again, natural estrogen, when based upon science-based test results, helps protect against heart disease, osteoporosis, aging, and helps promote healthy breasts. The opposites of drug-based estrogen therapy, estrogen replacement therapy brings with it far more potentially deleterious effects than good. In fact, they were doing some studies some years ago, and they had a number of females on estrogen replacement therapy, and they actually stopped the study because of the increase of heart disease and other estrogen-related diseases that were in it. They found that it was not ethical to continue the study.
And I think also there's a lot of issues that we see that women are coming in who have been on natural estrogen therapy from chiropractors or nutritionists, kinesiologists, or on their own. And then we go and check their female or male hormones and found them just to be nuts. I
They're
mean,
off the
wait,
charts.
Yeah, off the
Yeah.
charts. And they're
Yeah.
saying, how could that be? It's natural. Well, there are a lot of potential adverse effects from the natural, too.
Not to mention the delivery. The way that they take the estrogen, many times they'll take it orally. Now, if it's taken orally, it has to go through the digestive tract, and then it has to be repackaged by the liver. And what they're looking for is not only the estrogen results, but once you take one anabolic steroid, that in turn signals the other anabolic steroids to do their things also, such as human growth hormone, which is touted as the hormone of youth, right? Well, if you have human growth hormone, there's a second hormone that's produced by the liver that's called insulin-like growth hormone. And the liver stops producing that just because you're taking it through the mouth. So it's more of a cream kind of thing, bypasses all that.
And we
So
don't
it's-
know if the cream really has in it what the label says, because they won't give us independent laboratory testing of independent analysis, see?
Right.
But go
right.
ahead.
So let's go on to natural estrogen replacement therapy. Supplements contain ingredients which have estrogenic properties. Some work, some don't. Some contain what it's supposed to have. Some may not contain as much of what it says is in there, just because they're not regulated by the FDA. Should not be used before a female hormone analysis is performed, because if you don't see, you don't know. And if you don't know, you don't have the information to make an educated suggestions.
Right.
If you don't see, you can't correctly manage, which is the next point. Many are hurting themselves with natural ERT. Why? Because they're not informed and they don't know about the deleterious effects that can occur. So it behooves you to have yourself tested in that regard, or go to a healthcare practitioner that will do that.
Science-based, folks. So let's talk about then some of the signs of estrogen imbalance. Water retention, breast swelling, fibroids in the breasts, depression, mood swings, loss of libido, weight gain, anxiety, heavy or irregular menses, and saddlebags. Saddlebags meaning, of course, excessive deposition of fat in the hips or thighs. Continuing on with signs of effects of estrogens now. What do the estrogens do? What did God design them to do? He designed them from what we know now. I'm sure we don't know everything about it. Cellular proliferation of the endometrium. We're talking about the uterus here. Another condition where estrogens are off balance are endometriosis, menstrual cramps, breast enlargement, fibroid tumors, increased body fat and salt retention, increased blood clotting, decreased libido. Now, effects of estrogens continued. We have a few more to discuss. Diabetes or hypoglycemia, high blood sugar or low blood sugar, loss of zinc. Zinc's very, very important for the immune system. Retention of copper, which can poison the blood cells, increased risk for uterine, ovarian, and breast cancer. Dr. Jensen was just talking about that. Osteopenia or osteoporosis, loss of muscular and vascular tone. Now, how do we deal with excess estrogens? Naturally. One is through diet. If there is a concern regarding excess estrogens, one should avoid foods that are known to contain hormones or phytoestrogenic properties. That's diet. Secondly, they can consider supplementing their diet with what is called IC3+, or another name for it is called indole-3 carbinol, and DIM. These are natural chemicals known to assist in assisting the body in ridding itself of excess estrogens. We have no information that IC3+ or indole-3 has any potential adverse effects on the body. Now, Dr. Jensen, then another question that has been asked of us is, what are progestins?
Okay, and progestins, of course, they're any compound or any other natural progesterone that is able to sustain the secretory endometrium. And progesterone is a progestin made by the ovaries. However, there are synthetic progestins, and the problem with these is sometimes they're interpreted by the body as foreign materials, and anytime something is noted as foreign, then the body has a reaction to it, and some of these reactions can be adverse in nature. So then we have Provera. Provera, or medroxyprogesterone, is a synthetic hormone made from the urine of horses. It is fat soluble, so it's when you have something that's fat soluble, it's absorbed by the intestinal tract. Up to like 94% of it is absorbed, and since it's fat soluble, it can move straight in through the cells without any problem. It could be used transdermally, so it's like a cream that just gets absorbed in because it's fat soluble. It passes right through the skin, binds to the receptor sites, and can contribute to bone loss or osteoporosis when used out of correct measurements for that person. Now, the possible adverse effects of Provera. It can cause birth defects, thrombophlebitis, or should we say blood clots that are circulating through the system and can result in strokes and things like that. Liver dysfunction, vaginal bleeding, cancer of the breast and ovaries and uterus, just because it's sensitive tissues, fluid retention, asthma, edema, skin rashes, acne, alopecia, hirsutism, which is an increase of body hair, and epilepsy can also be formed in here. And we've talked about that on other shows where some of these hormones are neurohormones, and so that they affect the brain as well. And sometimes you hear about people who take anabolic steroids and end up with brain cancer. That's one of the processes that deleterious effects that can result. So some more possible adverse effects of Provera would be nausea, insomnia, dizziness, fatigue, depression, nervousness, changes in libido or sex drive, loss of scalp hair, PMS-like symptoms, and changes in appetite. Some other things that can have deleterious effects is losing health with some food supplements. And these are normally through, sometimes you call them snake oil salesmen. Now, the snake oil actually had some ingredients that would help in some processes, such as heart disease and blood pressure problems and cholesterol problems and things like that. So actually, what they were peddling had some stuff, but we usually use snake oil salesmen as...
It's called voodoo nutrition these
Yeah.
days, and I have yet, in the years that I've been in practice, to see any medical doctor who prescribed Provera do a 24-hour urine analysis on the hormones. And I have yet to see any chiropractor, nutritionist, or people using kinesiology, or people selling, multi-marketing people, that before they recommended using natural estrogen or progesterone compounds, that they did a hormone analysis first. Mm-hmm. But when we examine those women and men who are having hormone problems, and when we do the hormone analysis and blood analysis on them, some of their hormones are so excessively high that it's no wonder that they haven't gotten better. They're actually getting sicker, right? So what they're basically doing is playing Russian roulette with your health. God didn't design you to play Russian roulette with your health. God means for you to live long life and good health, and He's designed it that way. And it's not a religious thing. It's not a religious thing at all. Christianity isn't supposed to be a religion in itself. What it amounts to is when we accept Christ as our Lord and Savior, His Holy Spirit enters our spirit. Our spirit is the real person that we are. And that great physician, that Holy Spirit, comes alive in us and then begins to give us the wisdom and knowledge, just not the gifts of healing and prophecy and all the other gifts that we participate in our Thursday evening meetings, but that we need wisdom. We need wisdom. And you could take advice from me today, in 20 years find out that, hey, this was bad. Look at all the number of years that Provera was prescribed. And here we're ending up with women with all kinds of health problems. Look at the number of men today using testosterone patches just so they can be more virile. And nobody's doing much of any hormone testing on them. Or some chiropractor or some person using kinesiology doing muscle testing, which is fine. But what do the lab tests show? It doesn't cost that much money to do it. It just takes some time to do it. But you can see a lot more patients doing this than having to sit down and analyze a blood report or a hormone analysis report. But again, it's called due diligence. And I think it goes back to the fact is, if Jesus Christ walked into your office, if you were Jesus Christ, would your doctor, the doctor that you're going to, be treating you the way you're being treated? Would he or she be doing tests or not, or be doing more due diligence? So again, seek the Lord's wisdom and knowledge. You'll find it. You really will.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, Thank you for listening to House Call.